Well, hello everyone. It's 1 o'clock, so we'll get started. So welcome to this webinar called Building Healthy Public Policy, Measuring Your Progress. So my name is Martin Renaud. I'm the scientific advisor at the National Collaborating Center for Healthy Public Policy. So I'm really happy to be here today and happy to see this great turnout. So it shows great interest in this topic. So welcome again. I'm joined today by my colleague Mylène Maguire. She's a communication officer and will be in charge of technical support, so making sure everything works smoothly today. And we are also very pleased to have four great presenters today. They will present the findings of projects they have completed together about ways of measuring healthy public policy work. So the presenters are Andrea Botkin. She's a senior program specialist at Public Health Ontario. Bernadette Walicki, a foundational standards specialist at Public Health Sudbury and Districts. Kimberly Aslett, a research policy advisor at Algoma Public Health, and finally, Jillian Connolly, a program manager at Ottawa Public Health. So we thank them for their presence. As you'll see, it's really interesting what they have to present. And I'll let them present their teams in a few minutes. I'll just have a few things to say before we move to the presentations. So we are the National Collaborating Center for Healthy Public Policy, so NCCHPP. Our mandate is to support public health actors in their efforts to promote healthy public policies. We're part of a network of 6 centers. Each center has a different focus, but we all try to support public health actors across Canada by providing resources, training, webinars, things like that. You will see in the chat box, they will post a brief overview of our organizations. And there's a link to our website as well. So we encourage you to consult our website. You'll find plenty of interesting resources and events that we're organizing. Our offices are in Montreal. So I would like to acknowledge that we are on an age-old Indigenous territory, a place of meeting and diplomacy between peoples, and the site of the signing of the Great Peace Treaty. So I'd like to thank the Kanekahaga Nation for their hospitality on this unceded territory. And just a few elements of housekeeping before we move to the actual content of the webinar. We start with a presentation presentations by our guest, and after that, at the end, we'll have a question and answer period. So if you have any questions for the presenters, please use the Q&A box at the end of your screen. At the end, I will transmit some of these questions to the presenters. And please note, you can also vote for these questions, so that helps us select some questions, because usually we have plenty. And if you have anything else you'd like to share, a comment, useful resource, an experience you had, you can use the chat box. Make sure you select send to everyone. So if you have any questions, Q&A. If you have anything to share, the chat box. And if you have any technical issues, please use the chat box to name them, and my colleague Mylène will be happy to help you with it. So last few things, the webinar will be recorded, including the discussion boxes, so questions, for example, and the recording will be made available on our website. And lastly, you will receive an evaluation form that will be shared with you through email. So we ask you to please take a few minutes to fill the evaluation form, provide comments, suggestions, anything about the webinar. It helps us a lot to know what you thought and to improve our future work. So that's it from me now. Thank you very much, and I'll pass the floor to Andrea. Sorry, just sharing. Trying to stop sharing. Sorry about that.
Good afternoon, bonjour and bonjour. Thank you so much, Martin and the National Collaborating Center for having us here today. We're very excited to talk to you about our project and happy to have so many of you here today. So my name is Andrea Bodkin. I'm just going to find my slide advance button. There we go. So my name is Andrea, and I'm here as Martin introduced us with Bernie, Kim, and Jillian, and we're going to be sharing the results of some research that we have recently done as members of the Ontario Healthy Public Policy Community of Practice. Today, we're going to refer to that as the COP to make things just a little bit easier. And the COP consists of representatives from Ontario Public Health Units, plus myself from Public Health Ontario and Martin. And we meet quarterly to network, share information, and work on collaborative projects. One of those collaborative projects was a systematic review on measuring the process of developing healthy public policies. The four of us formed a team to conduct the systematic review, and today we're going to be presenting our results. So you will be able to find the results of our review in two documents, one in English and one in French, which you can find on PHO's website. And I will copy and paste the links to those two resources once the next speaker is started. So in our presentation today, we're going to start with a little bit of background. Bernie is going to talk about the methods for our systematic review. Jillian is going to talk about our results. Kim is going to present a case study, and then I'll be back to go over next steps and key messages. And as Martin mentioned, we will have a Q&A at the end of this session. So starting with a little bit of background. I think we all know by now that building healthy public policy is a cornerstone for health promotion and for public health practice. Each of one of you can probably think of multiple policies at the organizational, municipal, provincial to territorial and federal level that can promote or can challenge health. Policy is a major lever for us to create supportive environments, to change the social conditions in which people live, learn, work, and play, and address inequities in society. So policy building is important work, and it's difficult work. It involves a lot of steps and multiple activities, and sometimes it's shrouded in a little bit of mystery. But this particular model was developed by Public Health Ontario in consultation with this community of practice, the COP, in 2005, and it illustrates 8 steps for building healthy public policy over 3 phases: planning, implementation, and evaluation. While you can see here on the diagram, the steps are linear. Steps 1 through 8, you do the first one and then you go on to the second one. In reality, policy work is anything but linear. Activities might take place concurrently at the same time, or they might be ordered differently from what's pictured here on the screen. Some steps can take longer than others. The work as a whole can take years. If we think about some of our most important policies for public health, for example, smoke-free policies or housing policies, some of those took decades or multiple decades to actually be enacted. So the implementation of the policy that you've been working towards is not the only measure of successful policy work. There are multiple outcomes that can be achieved throughout the planning phase of policy work that can demonstrate your success. And measuring these outcomes can demonstrate to your funders, to your partners, to your communities that what your work is accomplishing in the short and medium term is important. You are achieving success. You can also learn what is working, what is not working in real time, and this allows you to refine strategies and inform the next steps for your work. In some cases, the ultimate goal of having that policy isn't realized, but by measuring the results of the process of building HPP, healthy public policy, achieving the outcomes, potentially leveraging those successes, you can do that in other work. This is what we, the Healthy Public Policy community of practice, were really interested in examining, is how we actually can measure the results of our work. So I'm going to pass the mic over to Bernadette to talk us through the methods.
Yeah, hello, bonjour, Annie. I'm presenting from within the traditional lands of the Robinson-Huron Treaty and Treaty 9, and I have the pleasure of presenting the fun part of this work, which is the systematic review methods. We have two research questions. We had two research questions when we started, and the first focused on identifying indicators for public policy development, which is what measures such as metrics, indicators, milestones, benchmarks, and other measures, etc., indicate progress towards building healthy public policy. The second research question focused on identifying tools, etc., to measure those indicators. And that research question was what tools, resources, processes exist that can support local public health units in measuring their effectiveness in building healthy public policy. As part of our methods, we conducted a systematic review. A PHO librarian assisted with our research, which comprised of databases and customized Google search strings and gray literature. We dated our search back to 2007 to align with a key resource from the Anne E. Casey Foundation. An e-scan of resources from the Healthy Public Policy Community of Practice members resulted in finding one guide from the Kingston, Frontenac, Lennox, and Addington Public Health Unit. We also worked with key informants such as the NCCHPP to identify additional papers. In terms of the inclusion criteria, we were looking for published and gray literature that evaluates or measures the planning phase of the policy development process, relevant to public health and/or health promotion. Excluded literature included anything that focused on developing, implementing, or evaluating the policies themselves. The results of the literature review included 686 published studies, 230 studies from gray literature, for a total of 916 screened studies. From those, 865 were excluded. We conducted a double screening of title and abstract and resolved disagreements between two reviewers when needed. There were 51 full texts that were double screened and assessed for eligibility. From those, 16 texts were selected for inclusion. What became quite clear is that terms used to measure our policy work are nebulous. Terms and studies were used interchangeably and not defined. For example, one resource might supply a list of outcomes and another a list of indicators, but both lists were very similar. We ended up with a mix of broad achievements and specific measures, and occasionally strategies and activities. So we needed a way to categorize all measures in a systematic way. To assist with this categorization, we used definitions from the extracted literature. In plain language, outcomes are the changes that you want to achieve or have achieved, and indicators were defined as how you measure that change. The categorization of outcomes and indicators were done by two reviewers, and again, disagreements were resolved between the two reviewers. Coding and theming were completed by Andrea and reviewed by Kim and myself.
Thanks, Bernie. It's Jillian, and I work in Ottawa, so I'd like to just take a moment to acknowledge that Ottawa is built on the unceded Algonquin-Anishinaabe territory, that the people of the Algonquin-Anishinaabe Nation have lived on this territory for millennia, that their culture and presence have nurtured and continue to nurture this place. And I'm delighted to share results with you today. So our greatest discovery for this research was that there's many indicators and outcomes to measure the progress of building healthy public policy. I've worked in this area for many years and have struggled tremendously in demonstrating the progress. As Andrea kind of talked about earlier, like the whole process of building healthy public policy takes a really long time, and documenting your progress along the way is important, but I really haven't found anything that's been evidence-based to do this work. And so I'm really excited that we were able to identify so many evidence-informed indicators and outcomes that public health practitioners like yourselves can use to document and demonstrate your progress of doing this work. So from the research articles that were included, we extracted 229 individual indicators. And from there, we refined our list through an iterative process. As you can hear, this is an ongoing iterative process. It took a lot of work. Of 2 reviewers coding the data, we consulted healthy public policy groups, including the NCCHPP and our own provincial community of practice, and had many discussions with our own team. From this work, we were able to validate our findings and discuss applicability was specifically within the Ontario public health context. That was a big key element of our work here. And so from all that work, finally, we were able to identify 15 outcomes and 61 corresponding indicators. This is still cumbersome. So we just kind of thought we were not going to just send this huge list out to everyone. It would be just too much. So we actually categorized these outcomes into 3 broad focus areas that are listed on the slide there. Just to note that we acknowledge that this list of outcomes and indicators, why it's long, it's not exhaustive. And before I jump into the categories and the results in a little bit more, just to kind of highlight some of the limitations of the data, was through the articles that we did select and did review, there was a really great focus on advocacy in the US context, which wasn't obviously what we were looking for. And at the same time, there was a real lack of content related to that local and municipal work, such as informing municipal plans or policies, preparing reports to the Board of Health, which is part of our daily work. So these were some of the limitations. So the next few slides, I'll dig deeper into the 3 broad categories that I introduced here. So our first category is the partnerships and collaboration. Just next slide, Andrew. This category describes the development of mutually beneficial relationships with other organizations or individuals. And this captures the process of building and fostering collaborative relationships throughout building the healthy public policy process. These outcomes and indicators seek to measure deepening relationships and broadening partnerships over time. As you guys all know, the key element of healthy public policy is working with other sectors and other partners. So within this category, we actually identified 4 outcomes and 13 corresponding indicators. On the slide is just some of the examples of the indicators. So just to dig into a little bit more, an example of an identified outcome is demonstrated collaborative outputs. The corresponding indicator we identified is the number or type of meetings with relevant policymakers. So the table 1 of the focus one, it includes a full list of the indicators, which I'm happy we could put into the chat there. I can see you guys looking at that. Next slide. So our second category is sphere of influence. And this was one that we went back and forth of and really trying to figure out how do you best describe all this complicated work. And so we selected the term sphere of influence to really describe the process of influencing and shifting the awareness of policymakers, the media, and public. This is the largest category you'll see with the most indicators, outcomes, and tools. And I'll get into the tools a little bit later. The outcome and indicators in this category measure a number of factors needed to shift perspectives and awareness, including the visibility of the issue, the saliency of the issue, and that's the importance assigned to the issue, political and public strengthening the base of support. So just a little context for this category. So when you're trying to build healthy public policy, it's hard to move to the next stage of developing or implementing a policy if people aren't aware of the issue or don't think it's important. So if you kind of think back to the 1950s and 60s, people really didn't understand or know the impacts of smoking on health. And so it was really difficult to make any policies to reduce smoking rates. And now that's well known, and moving forward on those policies are easier. A more recent example is the knowledge and awareness that parents have of the impacts of increased screen time and social media for kids and teens. And so that in itself is helpful to build momentum to move to planning healthy public policy, implementing public policy. And so this is something that we've obviously seen recently in Australia with their current social media ban for teens. So digging deeper into this one, just looking at one example, is if you're measuring political will, which is the willingness of policymakers to act in support of the policy, you could measure the number of meetings or education interactions that you've had with policymakers, or policymakers' knowledge and awareness of the issue. The final category is organizations' capacity to plan and carry out the process of building healthy public policy. So while this is the smallest category, it's actually foundational to this work. So this category recognizes that organizations must have the staff, leadership, and organizational structure and systems for the work, as well as staff with particular competencies. So an example of an outcome is organizational capacity to advance healthy public policy, and examples of this could be organizational knowledge about building healthy public policy, number of staff trained to do this work. So moving on from the categories to the tools. So I don't know if you guys are thinking like all these indicators and outcomes I'm sharing, like that sounds really great, but how would I actually measure these things? So great news, as part of our second research question, we identified almost 50 tools to do this work. So first we examined the included papers and identified papers that actually included tools. And from there, we identified 4 broad types of tools. So the first one, which has the most amount of tools, is tools just to measure the specific indicators. The second one, which is really, really helpful, is guides or step models that help you walk through the process of how do you measure your policy efforts. So it's not just the indicators and whatnot, it can kind of help you understand how do you kind of get there. The other one was tools to develop a theory of change or logic models. And finally, data collection methods and tools. So kind of the whole array that is needed to do this work. And you'll notice table 1, 2, and 3 in the article includes outcomes, indicators, and actually links directly to the article, the tools as well. There are some gaps in the outcomes you'll also notice. This work truly provides a stepping stone to help public health professionals to measure the progress of building healthy public policy. And the article also outlines how do you actually use the indicators and outcomes. My colleague Kim's going to dive into a case study just to really give a really great example of this, but just kind of quickly, the literature recommends developing a conceptual map to illustrate the planned activities that will achieve your policy goal. So you identify your policy goal and then what are the activities that are needed to do that. And as I said, there's tools to help you with that. And the literature also indicates that this work can be done retrospectively or prospectively. And finally, the importance of actually selecting meaningful measures. Once you've identified the goal for building healthy public policy, the actions to achieve the goal have been identified, the outcomes and indicators to measure it can be selected. There's a really great quote in the article that says, "Sometimes we forget to distinguish between what can be measured and what is worth measuring. Tracking the number of meetings with policymakers is necessary, but not sufficient to tell whether we are persuading anyone to create positive policy changes. When evaluators look at proposed measurable objectives, they must ask themselves and their clients, so what? This will achieve the objective to tell us something we really need to know." So with that in mind, the research indicates that the best way to have some meaningful measurements is to select multiple data collection methods, a range of steps and activities, include process, outcome, and outputs, and making sure that they're feasible, important, and relevant. And so I'd like to now pass it on to Kim to share a case study and dig into the application in greater detail.
Hi, I'm Kim Aslett. I'm speaking to you from Sault Ste. Marie, and I'm on the traditional territories of the Anishinaabeg, Illilouak, and Wisiku-Diwinawak Métis Nation. And this includes some of the Robinson-Huron Treaty, Robinson Superior Treaty, and Treaty 9 territories. And we say miigwech to thank the Indigenous people for continuing to take care of this land from time immemorial. So I'm going to share a case study where I worked with a health promotion specialist to use these indicators to reflect on our project and as a learning tool for our team. Next slide. So over the next few minutes, I'll talk about the context of the drug crisis in the North, the project, which was the Toxic Drugs in Algoma Community Assessment and Next Steps, and how we applied policy outcomes and indicators retrospectively, and some of our lessons learned. Next. Algoma Public Health is an autonomous board of health. Policy activity is distributed through program managers, health promotion specialists, the medical officer of health, the assistant medical officer of health, and the board. APH's boundary covers over 41,000 square kilometers in Northern Ontario and contains 21 municipalities, 2 large unorganized areas, and 8 Indigenous communities. The region serviced by the health unit stretches over an 8-hour drive along Highway 17 from Spanish in the east to White River in the north. Next. So this word cloud shows responses from the survey that was done for this project of people with lived and living experience, family, and friends, asking how they feel society sees people who use drugs. Stigma remains a barrier to services and community support. The toxic drug crisis has hit hard in Northern Ontario. In 2022, the rate of deaths due to opioid toxicity in Algoma was almost 3 times higher than Ontario. Post-pandemic, the city of Sault Ste. Marie continues to be among the top 10 census divisions in Ontario with the highest opioid toxicity mortality rate. Next. This toxic drug situational awareness project was started in 2020 with community partners and was almost immediately interrupted by the pandemic. When we restarted the work in 2022, people with lived and living experience and then family and friends were interviewed. This is where I became involved in data analysis and ethics. We used an external consultant to assist with community partner workshops to discuss and validate the findings, and then to identify community actions to move forward. The report was finalized and launched through the end of 2024 and into early 2025. Next. Near the end of my work on the Toxic Drugs Project, I started the work on the indicators and outcomes with Andrea, Jillian, and Bernadette. Timing made this a good opportunity to use APH activities as a demonstration of the indicators and for internal capacity building. The health promotion specialist leading the project was my collaborator on this. This also became a presentation to our Healthy Public Policy Community of Practice, the COP. And just to reiterate, outcomes are the short to medium term changes that result from the policy development process, and indicators are the measurable qualitative or quantitative factors that provide the means to measure the changes. Next. So the first category we looked at was partnership and collaboration. We matched the indicators to the activities in the logic model for the project and to records kept by the project lead. Outcomes that were identified here include, first, establishing mutually beneficial relationships with other organizations and individuals. So we had 2 workshops with more than 40 participants, many of them new to this process. Second, we saw an increased level of collaboration with a new drug strategy committee being established outside of the city in the district, a rural committee identifying increasing collaboration as a goal, and informal exchanges between partners to support better cooperation. Third, we saw increased level of alignment with partners brainstorming and prioritizing their own solutions and actions, and with the results of the report being used as a tool to guide actions in the local committees. And fourth, we looked at demonstrated collaborative output with evidence-informed practice session of the report, which gives an overview of policy and program options, and a new drug strategy committee that's meeting monthly. Next. During the first theming workshop, 11 community partner agencies gathered at the Indigenous Friendship Center to look at the survey data and to build a SWOT analysis, allowing new partners to meet and allowing for discussion of gaps and priorities. An external facilitator led this activity, allowing us to interact as partners. Results included establishing a process for partners to share timely information for early warning systems, so drug alerts, distribution of drug test strips for harm reduction, and increasing engagement of people with lived and living experience. Next. The second workshop took place at APH, and here 40 partners gathered, including social services, housing, mental health services, legal services, municipal representatives, and more. We did a roundtable for each agency to present about themselves, and we then worked together to prioritize the content from the first workshop. Next. For the sphere of influence outcomes, we looked at relationships related to outside of those within our own partnership and collaborative. So those include the public, the media, policymakers, and the community at large. And the actions we found under increased awareness were presentation of this project to the Algoma District Mayors Association and a presentation to Sault Ste. Marie City Council. Second, we saw an increase in new champions with municipal leaders participating as partners. And for strengthened base of support, we saw increased involvement of grassroots agency as well. Next. We saw an increase in salience that was demonstrated by responses from community representatives from the city, local Indigenous Friendship Center, a physician leader, and the Housing Administration responding to the project. Next. We also saw from November 29th, 2024 until June 9th, 2025, our online report receiving 718 views and 321 downloads, along with several media mentions that generated more conversation. Next. The organizational capacity indicators capture the skill sets, staffing and leadership, organizational structure, and systems to plan and carry out policy work. Actions that were identified for capacity included the report increased capacity of the Drug Strategy Committee by providing statistics, SWOT analysis, and recommendations, and a higher profile of expertise at APH for media contacts. Second, the increased ability to lead local partnerships or collaborations with the co-chairing of 2 committees. And third, demonstrated credibility of the organization with the speaking to the Algoma District Mayors Association, being seen as a credible source of surveillance data and contribution to a successful Heart Hub application. Internally, APH now has an ethics review board of record, and we established a relationship with Nordic, a local research and knowledge organization, for facilitation. Next. Finally, our lessons learned throughout the project, not necessarily about the indicators, but overall, were that local people were eager to gather in person together with other community partners to talk about what's happening and to generate solutions. We found that we should seek ethical review for all projects involving vulnerable populations, even if we didn't expect to publish. Using an external facilitator allowed the health unit to be a partner at the community table. And in large geographic areas, it's helpful to include local conversation where needs and resources can be very different. and to think outside the box for partners to invite. Many are eager to gather and contribute. And for involving people with lived and living experience, that we should budget to pay them for their participation and get feedback from them. Finally, I'll be happy to take any questions during the question period to follow, and you can see my contact information below. Okay, back to you, Andrea.
Okay, thanks for your patience as I have terrible mouse issues today. I'm not quite sure why. So we thought we would wrap up this quite intense presentation with just a few takeaway measures or messages rather. Firstly, as Kim talked about in her case study, the outcomes and the indicators that we identified from our research can be used retrospectively, so at the end of a project, or prospectively as a planning tool. In the beginning stages of your work, then you can select the outcomes and indicators that are going to measure what you are planning to do as part of your policy development process. It was mentioned in the research, and it just really bears repeating, is that we do recommend developing a theory of change or a visual map, such as a logic model, to illustrate what it is you were trying to accomplish and what activities are going to take you there. And then you can select the outcomes and indicators in order to demonstrate that you have achieved that. So we often think about outcomes and indicators as simple measures. I've been in health promotion for a long time, and I remember a lot of reporting counting bums in seats. We always used to say, how many brochures have you distributed? How many people came to your presentation? Those things can be important and they can tell part of the story, but only part of that story. Selecting a comprehensive set, a group of indicators that includes process, output, and outcome indicators can help you to tell the story of your work over time. So if I just give an example of the partnership indicators, one of them is who is on your coalition and what sectors do they represent? And another one is how collaboratively or how intensively do you work with them? If you measure that on an annual basis, hopefully you're going to see the shift in your coalition, and you're going to see more and more partners working with you more and more intensively. And you're going to see the number of collaborative projects that you do increase over time. So the indicators are meant to be used as a snapshot that you then repeat regularly so that you can get a sense of your progress. And finally, we do encourage you to read our focus on measuring progress in healthy public policy, to read the full results of our workshop, our research rather, including our suggested tools. And thank you again to the NCCHPP for having us present today.
Well, thank you very much, Andrea, and thank you everyone for your presentations. That was very interesting. Those are great findings. So what I'll do now is go over the different. We already have a few questions in the Q&A box. I remind you that you can use the Q&A box to formulate your questions, and we'll pass them along to the presenters. So I'll just go in order of the questions I see, and you can take the mic if you feel you can answer them. So the first question by Babak Salmani, what data collection methods, so for example, surveys, document, reviews, interviews, were most commonly embedded in the tools? And can you speak to why these methods were prioritized?
Wow, I feel like I probably should have reread our resource this morning. Can anyone jump in and answer that while I look at our inventory?
Yeah, so the it's data collection methods that were very specific just about data collection and methods and tools there was out of the 49 that we identified, there was only 7. So like as we said, we categorized 4 big categories of tools. One of them was about specific indicators, and some that might have had some tool like data collection, but was very like, how do you do this? There's 2 other categories that are kind of like how to, like some of this stuff is like, well, how do I determine the indicators? So one of them was about logic models and change management. So how do you kind of map it all? As I was kind of trying to say, is like that what's important. So there's 2 categories about that. And then the last one, data collection, was number 7. Like it just had 7 of them, but some of the data collection was integrated into the other ones. Um, so I think like so your second part is like what most commonly embedded. So most commonly embedded was mostly the tools to measure the indicators, but largely I'm keen on my colleagues to jump in. I think it's because of our question, like our initial question. It's a cyclical thing. Like our research question informed what was included. But then you said like why these methods were prioritized. I think it's also kind of our research question, but I think it's also we were looking at like some of it is intended to do like the how to, and then from that. Andrew, I don't know if you have other or Kim or Bernie any other additional points to add.
Okay, thank you. Yeah, from what I understand, that the questions you asked basically led to finding some elements and not others. Okay, that's great. Second question is a bit long. I'll try to summarize it. So, the question is from Sue Shikas. She says, "How do you define policy? Do you see it as a focusing just on legislation, regulation, bylaws that are legally binding to all levels of government?" So basically, I think the question is about like how did you limit yourself to what type of policies, or did you have like a really broad understanding of it, or did you put some limits to it, and how it fits your framework? So it's kind of an open questions on what do you mean by policy, and how did that influence your work and findings?
That's a really great question, Sue. So we defined it broadly, but also specifically. So what I mean by that is that a lot of the tools and resources that we found in literature that we included is from the United States. And there they tended to use the word advocacy where we would use policy. And so what we did in that case was we included resources that were specific to advocacy for policy. So not necessarily advocating in the broad sense, but if there was advocacy for a particular policy. And in terms of how we define policy, using PHO's 8-step model did help a little bit. But we were including federal, national, provincial, territorial, municipal, local, all of those different kinds of policies, not too much organizational, but really focusing in on those types of policy levers that would have the most impact on health. So I hope that that answers your question. Anyone else want to pipe in on that one?
Excuse me. I did just pull up the literature search content, and looking at the section for policy control, as you said, it included policy as we sort of understand that regulatory and government, but it also included terms like planning techniques, strategic planning, public health administration, intersectoral collaboration. So the search we did was quite broad, and then we narrowed it by taking out what didn't match the terms that we were looking for. So things that were clearly embedded in a US system that were relevant, or that were focused on advocacy of individuals or other areas, if that helps.
Thank you, Kim. Maybe I can move to another questions. There's one by Marie-Claire who's asking about did you find any qualitative outcomes indicators in the literature? I'm curious to know about that too. So how do qualitative work fits into indicators like that you found? Was it a particular challenge? Did you find many that are qualitative? So I'm curious to see what you have to say about that.
In short, there are tons. So there's like, I think that whole one of the sphere of influence, it's kind of like how do you actually know that you're kind of moving pieces along? Like some examples is the extent to which organizations and individuals' participation is valued by those in the collaboration. So how do you demonstrate value? So some of these are, we actually kind of went around is like you're talking about numbers or types or this or that, but some of them are about profiles of partners. So those are like a lot of the indicators. Some of them were quantitative, and then some of them capacity to do some work. And so I think a lot of the indicators, if you still read them, they're still kind of a little bit high level. They can be quantified, they can be quantitative, qualitative. Like a level of collaboration is one of the outcomes. So that's quite can be a qualitative piece. Andrea, you wanted to jump in or anything else?
Yeah, a lot of these things can be measured using scales. So, for an example of a scale, there's one very commonly used in public health for community engagement, which is the IAP2 scale. And I'm going to get the words in the wrong order, but includes things like um, informing, gathering, collaborating, etc. So a lot of these indicators, you could set up a scale or use a validated tool, maybe use some kind of partnership survey or doing survey work with your community and actually quantify in that kind of way. But I think that as Jillian said, the short answer is yes, we found qualitative and quantitative. And the other thing that I just want to mention is that both can be very important. And depending on how you're using the indicators in terms of, are you reporting on them? Are you drafting presentations? Are you creating infographics? You might do a narrative that has qualitative information and then provide quantitative indicators as measures of that. So I think both are important.
Thank you. A question now from an anonymous participant. Do you see case studies as promising way to explore indicators and outcomes tied to healthy public policies at the local and municipal level? So what ways do you think the literature gap could be filled? I guess the person means in terms of indicators that are applied to local and municipal level.
Yeah, I'm so glad that we have this webinar when we have it, because just last week, the community of practice met to talk about what we want to do with moving this research forward. Because, we identified 61, 63 indicators. It's too many. Nobody can use that many indicators. And so what we hope, and then the other big limitation was that lack of indicators at that local level that at least in Ontario public health units, really reflects the day-to-day work, preparing briefing notes, doing presentations to council, reviewing planning documents, and providing evidence-based recommendations to improve health, for example. So what we are aiming to do, and you might have to just put on your rose-colored glasses with me for a moment, is that we want to fill in those missing indicators, those local level municipal indicators. And then once we add that to our set of 63, we'll have even more. So what we want to do as a community of practice is actually prioritize those. So we are going to be undertaking some work. We're going to be reviewing local plans. We're going to be working with the community of practice. We're going to reach out to some of our partners and colleagues and program evaluators and epidemiologists, et cetera, to try to gather up that missing set and then go through a prioritization process.
Thank you, Andrea. Anybody wants to add something before I move to another question? All right. So a question here. Did you come across any methodologies, guidance for evaluation methods for policy advocacy in Indigenous health context? So, for example, working with Indigenous health organizations or Indigenous partners dedicated to Indigenous health initiative. And I would add to that questions about what you found. Maybe Kim, you mentioned in your case study that there seems to be a collaboration with the Indigenous Friendship Center. So maybe that you can explore that also. So, any methodologies, guidance, and specific for Indigenous context?
This one has a very simple answer, I'm afraid, and the answer is no. And of course, hindsight being 2020, and your question, such a good one, that perhaps more of a customized literature search or gray literature search may have helped identify some of those. So maybe that's something that we can take back to the community of practice and see if that is of interest, something that we could do moving forward. And then maybe I'll just suggest to Martin and the NCCHPP, and there is also a National Collaborating Center for Indigenous Health. Maybe that's something that could be explored further.
Yes, for sure. And it's often a challenge because in the literature we often see a gap about integrating indigenous perspective, and so that's often a really big challenge. And hopefully, the scientific literature will improve over the next few years. Uh, Another question. More general question. Malcolm asked, can you speak of the selection of indicators? With health promotion, a lot of the desired outcomes are systems based. How can you select the indicator for health promotion practitioners to demonstrate in the short term that we did that rather than the system evolved over time? That's an interesting question. Anybody wants to try to answer that?
I take a first crack at it, and Andrew or someone else wants to jump in. I think that feeds into one of the pieces that we were talking about is like having that logic model or change model is understanding like what's your goal and what are the activities that you're doing to get there. And understanding policy isn't linear. Like I think this is one thing that I've been personally struggling with policy. It's, I think when we talk about evaluation, and health promotion, that's where I started, and then I went to policy. And I think we kind of think linear, and policy I've always been like, we can't do this evaluation. It doesn't work like that because you can't demonstrate that. But it's true for systems as well. But you can kind of look at it and saying like, what are we trying to achieve? And it could be really broad. I'm trying to get more health promoting language and official plan into the built environment. Trying to think about more a human health lens from climate change. Those could be really big, and you could have some key activities like I'm just trying to develop relationships or trying to understand how this got to there. And then as you further refine your goal and understanding that, your activities get further refined and your indicators get further refined. And so part of it is that mapping out. And we said, it could be retrospective or prospectively is kind of that piece of the puzzle. So mapping it out, understanding that, and being iterative. This process is like your goals will change and be further refined. So like for our work, I'll just talk about this. Like we've been working on trying to get better like health promoting language in our city's official plan. 10 years ago, how we got there, like we have got there. I'm very proud of that. But if I had written it a year, like the first year we started doing this work versus what I would write down for evaluation now is very different. So it's kind of this iterative process. And so that's kind of helps you to kind of indicate like we did these planned activities and this is how it changed and we contributed to the system moving.
And that's such a great example, Jillian. And I would just add on to that that I think if we look at the outcomes and indicators and the focus on the three tables that we have, we would see that the outcomes and indicators are very focused on that locally driven work. So what did we do? What did we have control over? Because we have varying levels of impact on the systems, but we can show that we built relationships, that those relationships deepened, that those partners took over some of the work, kept our messages going, etc. So I think that our indicators are at the we did that level, that we have accomplished this level, I think.
Thank you. I'm looking at the other questions. There's one about it says that most of the outcomes and indicators presented seem to fall within the sphere of influence. So decision makers, influencer. So if we consider the multiple steps involved in the planning phase, has mapping across these steps been considered to see if other steps, like problem identification, policy options, readiness, are covered? So in other words, like, did you find that the indicators are often are about the same phase, or is there a way of expanding indicators to other phases? So I know I make it a bit broader, but what are your thoughts about this?
So remember, I'm going to call on the group. Remember in the beginning, we talked about mapping outcomes and indicators onto those first 5 steps. And what we found was that it's very difficult to do. So, for example, what step does building partnerships go in? It can go in all 8, or does it go in any of the 8? Is it really like across the entire process? So I mean, you're right. Sphere of influence was huge, and there are some outcomes that have more indicators than others, and there might be some that the literature really didn't cover, like that local level missing indicators that we talked about. So we didn't feel it was possible to map them onto the steps, but I'm sure if we kind of did that almost like retrospectively, like if we went back and looked to see, what other types of indicators are we missing, I'm sure we would come up with some. Like, for example, we really don't have indicators that talk about that defining the policy problem. So what indicators could help us measure what we have done in that area or how well we have done it?
I see questions in the chat. Seems it was impossible for Karen to put it in the Q&A, so I'll go to the chat to find it. So is it useful to distinguish between healthy public policy and healthy public programs? How would those be distinguished and defined? That's from experience. I know it's a difficult question, but did you think about this did you face this challenge? I would say while you complete your literature review.
You know, I guess the answer to your first question is yes, it's useful to distinguish between policies and programs. If you put me on a stool and made me define them, maybe I could throw some words out into the atmosphere. But I think it's interesting because we didn't have that challenge in this research. I guess, I mean, we're very lucky to have a PHO librarian to do the searches for us. And I think that really helped to make sure that our search criteria were narrow enough that we were really looking at policy and advocacy for policy. So I think that it was one of I can't quite recall, but I feel like it was also an exclusion criteria as well. If there wasn't a policy goal, if there wasn't a policy lever, we did not include it. So we were specifically looking at policy. I hope that answers your question.
Yeah, thank you. I think it does. There's another question who just came up. So, how many of the indicators and literature, how many of the indicators discovered were theoretical and how many were applied? And how do you think that this will change and be more applied, evaluated as this develops and goes forward? So, I guess the question is about the application of these indicators. Did you find many indicators that were difficult to just or it seemed difficult to apply in real life? Anybody wants to jump in if the question is clear enough?
I think Kim's example provided that many of them are applicable. Like her case study really articulated all of that. I know, Kim, not to talk on your behalf. But I think the other piece was when I was doing this, I think that's what I got excited about was I think they all could be applicable. I'm like, oh, this is great. Yeah, that's definitely like some things I hadn't thought of. So I think as Andrea said, I think we'll further refine the list, building on Kim's great work that she did. But like initial crack at it, I think most of them are very applicable because that was one of the criteria too. As we said, we had 229 and we got it down to 61. So I think through that process, we also kind of asked like what's applicable and what does that look like? And that's kind of some of the exclusion pieces that happened after that.
That's very
The other
interesting.
thing I,
Sorry, go
oh,
ahead, Nadir.
Kim, please go ahead.
Just briefly, I, on my own, outside of the program and outside of the project, or just peripheral to the project, would not have been able to apply these without the knowledge and the detailed information that was collected by that project lead. So her understanding of the nuts and bolts of the activities on a very practical level, which I did not have, made it possible to see the applicability of those statements and to apply them to our records. So I would not have, from just a policy seat, have been able to do that. Her broad experience made it possible.
And the last thing I would add onto that is that one of the things we were really lucky to do was to include gray literature. And most of the gray literature that we included were workbooks and toolkits. And so in that case, it was, many times developed for agencies, maybe funded agencies or other partners to actually implement. And so there was often a step model, and here are the indicators, and then here are the tools that you can use to measure those indicators. And so it was like a lot of those workbooks were very applied in that way. I think some of the published literature, and I think that we find this quite often. It's so great to read a literature review. Obviously, I'm biased. I think ours is pretty cool, but sometimes it's difficult when you get this list, like in our case of 61 or 63. I keep forgetting the number. There are so many. What do you actually do with that? So the published literature is very important, and also the gray literature with those workbooks, and here's a process, and here are some tools, and here's how you design this, and here's how you figure out what your research questions are, and here's how you develop a theory of change. That practicality is really important.
Thank you very much. Another question just came up. Are any of the tools evaluating policy from specific lenses? So human rights, equity, accessibility. So do you remember if you found any tools that are from specific lenses like this?
Sorry, I just am always pausing to see if my partners in crime want to answer a question. So definitely, I feel like there was a definite human rights lens to many of the tools that we looked at. There was at least one workbook or toolkit from UNICEF, and potentially more than one. A lot of the resources from the United States tend to have a social justice lens. I don't, off the top of my head, recall anything around accessibility, but I think human rights and equity, if you take a look at those lists, you might find some.
Maybe one last question of my own to wrap up. I'm wondering if because I thought about what Jillian said earlier about like all the applicability that you saw while you were doing the work. So do you remember any specific tools or specific indicator that you thought, okay, that will be really interesting in my work? That very concretely that surprised me. I didn't think about that, and I could use it in my own work soon or right away.
I think some of those, like the conceptual models, to be very honest, because I think that, as I was saying, like I think from a policy perspective, I often didn't think that was possible. So even just reading that from a policy lens and understanding that, and then understanding it could be iterative and not hardcore. So like the theory of change, the outcome mapping example was kind of something like applicable, easy to like to kind of go through and see and understand from the policy lens.
And I'm kind of at the other end of the spectrum from that. Is one of the things that I was really excited about was the concept of salience, which is the importance that the audience assigns to the policy issue or the policy problem or policy options. And the specific indicators are around, how many people in your audience say that the policy issue is important, and how would people prioritize that policy issue? And then there are a couple of tools. There's a survey tool, and then there's an awareness tracking form that you can actually use to measure that. Now, I make it sound very simple. And of course, measuring attitudes across a neighborhood or a community or one municipality or the 21 that are within your catchment area like Kim's, I'm not saying that that is easy. However, if that is a priority, or if perhaps you have a smaller group or a smaller community where you can actually measure that, I think the possibilities of doing that are really interesting. And it's something, way back, like maybe 15, 20 years ago, I am sure that I wrote in my program plans that we're going to shift community awareness, but I don't know that it ever occurred to me that it could be done. So I got really excited about that one. It's a great question, Marte.
And I can add from a public health perspective that as part of program planning, we do have locally developed indicators that are very important for ministry reporting as well. And so this document and these indicators are certainly applicable at that program level as well. And especially as it relates to healthy public policy and the Ottawa Charter, as a standardized intervention, let's say, for example. So definitely a lot of applicability at the program level in public health program planning.
Okay, so I think we answered all the questions that came up in the Q&A box. So I would like to thank you all for being here today. Thank you to our presenters. That was very interesting. And I remind you that the recording will be available on our website as well as the slides. And we ask you to fill the evaluation form if you have a few minutes. It's always helpful to get your feedback, to know what you learned, what you liked, what we can improve. So thanks again, everyone, and see you next time.
Thanks.